Hello, and welcome to the IHSS Caregiver Education presentation on care for heart failure. Our names are Alvin Famba, Angie Nguyen, Henry Vu, Jasmine Wang, Shelley Huynh, and we're nursing students at the University of California, Irvine. Before we begin this presentation, we would like to give some acknowledgements. We'll pause here for you to read these acknowledgements. And with that, I'll pass it off with Jasmine.
Overall, the goal when caring for people with long-term heart failure is to provide a better quality of life and have lower mortality related to this disease. Now I'll pass it back to Henry.
Thank you, Jasmine. Here's a quick reminder about what heart failure is. Heart failure refers to when the heart can no longer pump enough blood to supply the body. And with that, I'll pass it off to Alvin.
Thank you, Henry. According to the American Heart Association, these are the goals when caring for patients with congestive heart failure. Today's presentation will include practical interventions and demonstrations aimed at meeting these goals. We will begin with physical activity. Back to you, Henry.
Thank you, Alvin. Under physical activity, we will be talking about monitoring for shortness of breath and maintaining an active lifestyle. Shortness of breath is one of the symptoms associated with heart failure, depending on the type and severity of the heart failure. Patients may experience shortness of breath while performing normal activities in their daily lives. Patients with moderate heart failure may not feel shortness of breath except during hard physical labor. In severe patients, they may experience shortness of breath even while laying down. The patient should note at what level of physical activity they begin to notice shortness of breath. This will become their baseline. If they begin to notice shortness of breath at lower levels of physical activity, they should notify the provider since their heart failure may be worsening. One way to manage the symptoms of heart failure and improve quality of life and life expectancy is to maintain an active lifestyle. However, it is important to maintain an appropriate level of physical activity since too much physical activity can have a negative effect on patients with heart failure. Check with the provider to find out what an appropriate level of physical activity is for the patient. Now I'll hand it over to Shelley.
Thanks, Henry. Another way to manage heart failure is to maintain a healthy fluid balance, which includes daily weight checks, monitoring for swelling, and making changes to your diet. Patients should measure their weight by wearing the same clothes, using the same scale, and measuring themselves at the same time. It's best to measure themselves in the morning, after using the restroom, and before you eat or drink anything. Patients should also mark their weight on the calendar. If they notice 2 to 3 pound changes, they should notify their healthcare provider. Now I'll pass it on to Angie.
Thank you, Shelley. One other way to monitor fluid balance is to check for swelling. You can track your fluid intake to limit excess amount of fluid you take into your body. One way to keep track of your fluid intake is to record the amount in a tracking sheet. It is important to keep the unit of measurement consistent to make it easier to keep track. In this example, it is helpful to keep everything in cc or cubic centimeter. You can refer to this chart to convert these measurements into cc. If you have any problem converting these measurements, please reach out to your healthcare provider for more assistance. For the next slide, we'll show you a video to demonstrate how to track for swelling.
We will now demonstrate how to monitor for swelling. Swelling is often most visible in the feet and ankles. Skin will appear stretched and shiny. To check for swelling that is not obvious, you can gently press your thumb over the foot, ankle, or leg with slow, steady pressure. Push gently on the swollen area with your finger for at least 5 seconds and then remove it. Your finger will leave a dimple in the skin if your leg is swollen. You should see a doctor to determine the cause of leg swelling. If both legs are swollen, your doctor will ask about other symptoms and examine you.
On top of monitoring for swelling, another important part of keeping a healthy fluid balance is making changes to what you eat. One of the main things for this is to consume less sodium or salt. We do this because water follows where salt goes, so if you eat foods with a lot of salt, then the salt will hold on to more water in your body. This will then lead to swelling and is overall bad for your heart health. Something that may help with this is eating fewer processed foods and fast foods, because these usually have a lot more salt than food you would cook at home. The CDC also recommends for patients to eat foods higher in fiber like fresh fruits and vegetables. This graph was put together by the CDC and has some information that you may find surprising. A lot of our salt consumption actually comes from processed food and restaurant foods, and not as much of it actually comes from foods that we prepare ourselves at home. This is why we recommend that patients with heart failure try to eat meals prepared at home instead of eating out. Now we'll pass it off to Alvin.
Thank you, Jasmine. Lastly, we'll be speaking about some general care methods to manage heart failure, which includes medication adherence and follow-up doctor's visits. Take medications as directed by your provider, making sure that you take it at the right time every day. Make sure that you take the medication by the right route, and additionally, ensure that you take the correct amount of medication. Doing so will improve quality of life for those with congestive heart failure and will prevent worsening of heart failure. Help your patients come prepared for follow-up visits by reminding them of the scheduled follow-up visit. Also, remind them to bring their current pill bottles, copies of recent lab results, and a document of their health history. You can also ask them these questions and write them down. What symptoms bother you the most? Are the prescribed medications causing any side effects so far? More information, such as example questions, can be found in the resources section under Making the Most of the Follow-up Visit. Here are some take-home messages. Take medications as prescribed. Be mindful of diet, especially reducing sodium intake and fluid, and weigh the patient regularly. Finally, here are some resources to help you care for your heart failure patient and help them have a better quality of life. These are our references for the presentation.
Thank you for listening to our presentation. If you have any questions, please contact Dr. Jung-Ah Lee for more information. Thank you.